Thank you very much, Chair. I represent International Physicians for the Prevention of Nuclear War, the founding organisation of the International Campaign to Abolish Nuclear Weapons. But I speak to you as a physician. The World Health Assembly is the global body of all your health ministers or their most trusted senior officials, which is entrusted to safeguard the health of the population of every country of the world. When considering the first landmark World Health Organization report on the effects of nuclear war on health and health services in 1983, they concluded that, I quote, "Nuclear weapons constitute the greatest immediate threat to the health and welfare of humankind," end quote. Responsible public policy has to be firmly rooted in evidence. But what has happened over the 33 years since what was identified as the greatest immediate threat to humankind? It has largely been denied, ignored and neglected. It's extraordinary that the first time governments met for the specific purpose of considering the humanitarian impacts of nuclear weapons in Oslo in 2013 was 68 years after nuclear weapons were first detonated in Japan. It's inconsistent that the well-founded global concern about accelerating global warming is not paralleled by concern about the greatest risk of acute climate disruption, which is nuclear war. Especially with 800 million people in the world already chronically hungry now, it is remarkable that no government or group of governments has yet commissioned and made public a report from its national research organisations examining the effects on the food and water security and the nutrition of its people from the climatic impacts of a nuclear war, even in a distant global region. The findings of such studies would provide a compelling opportunity for education of the public and decision makers to motivate and galvanise the preventive action that the Austrian ambassador called for. The governments, all of them represented here, can help cure the historical denial by basing their policies and action firmly in evidence. There is a relentless trend. The more we learn about the impacts of nuclear weapons, the worse it looks. On the long-term effects of ionising radiation, on the vulnerability of the global climate and food supply, on the fragility of our impressive achievements in global health and development. These are clearly most inconvenient truths for those who possess and thereby threaten to use or rely on the most indiscriminate and inhumane of all weapons. As Dr. Helfand said this morning, a real understanding of what nuclear weapons actually do invalidates all arguments for their continued possession and requires that they urgently be prohibited and eliminated as the only course of action commensurate with the existential danger they pose. Submitted before you at this meeting for the first time, all of the world's leading global federations representing doctors, nurses and public health professionals have come together for the first time to call for the prohibition and elimination of nuclear weapons as an urgent global health imperative. This assessment is based on the shared professional ethical obligation of health professionals to care for and cure the sick, to prevent disease and suffering, and to base our practice in evidence. You trust us with the health of your citizens, your families, yourselves, and you should. When your GP, your specialist, your nurse and your health department and their colleagues around the world speak with one voice regarding the gravest threat to health, it would be wise to listen and heed their advice. The historical evidence shows that for each kind of indiscriminate and inhumane weapon subject to a regime for their elimination, for biological and chemical weapons, anti-personnel landmines and cluster munitions, the establishment of an unequivocal norm of prohibition of weapons with unacceptable effects has preceded, enabled, and indeed been the basis for subsequent work towards their elimination. That is the proven logical path. It is also the only feasible practical option at this time. The states represented in this room cannot eliminate nuclear weapons they don't own, but they can unequivocally prohibit them internationally and in their own domestic legislation. Banning and eliminating nuclear weapons is the only way to secure planetary health. I thank you.